I'm lucky to have Professor Rolf Stahel. You've made the long journey from Zurich here to Lugano, Rolf, and you have a very important position here at the European Multidisciplinary Conference in Thoracic Oncology, because you are President of the European Thoracic Oncology Platform. But first of all, I want to ask you about ETOP, as it's called. But first of all, what about this meeting? You're getting some of the top cancer professionals here all together. What's the benefit of it?
Well, this meeting is a tremendous opportunity for the top academic physicians from different specialties to come together, to interact in a respectful way, to ask each other. And each time, last night at dinner, they tell me, it's amazing how much I learn from your profession each time. You know, very often we meet among our peers, which is at times boring. So we know what they expect, what they say. But here to meet with people from other professions, but having the same goal to improve the outcome of lung cancer is just a tremendous opportunity.
Much is being made these days of the word multidisciplinary and
Yes.
the need to cross-fertilise. Just what, in practical terms, can you get from that sort of cross-fertilisation?
Well, it's the only way to advise your patient with the best treatment opportunities. And you see, when I started in the field of oncology, things were moving in linear fashion. Patient would go to surgery, then they would be released. There would be a relapse, there would be the radiotherapist taking care, and then eventually there would be metastatic disease and the patient would be in some treatment center in medical oncology. And there was not much interaction between the colleagues, but we say, okay, he didn't take care, so the patient comes to us. Now, we see the patients together, at least for those circumstances where we need to meet with the patient more than one specialty. We discuss every clinical situation together on a board, and it's such a different thing to get different thoughts in. And what has happened over the last 2 years, which was new to the multidisciplinarity, is now the inclusion of the pathologist, who has a key role in helping us to decide what would be the treatment opportunity.
Individualizing therapy is a high ideal. To what extent do you think is it now a real possibility?
Well, it is in a way. I think there's two ways that come to it. Because individualizing or personalizing treatment means you have to be able to select between treatment options. If there would be only one option, you know, there's no individualization. So it has emerged that now several treatment options for similar situations are available. And then, of course, if you think, okay, an option is systemic treatment, which systemic treatment? And here the pathology comes in, because we know now that what we termed lung cancer or non-small cell lung cancer up to 5-6 years ago is a multitude of very different molecularly driven diseases. And based on the example on EGFR mutation and on ALK fusion gene and many other things that are coming now, we are very convinced that within a few years we will tailor the treatment according to the mutation status of the tumor of a patient.
Now, could you tell me about your relatively new baby, the European Thoracic Oncology Platform?
Well, I think it's an answer to the current needs, because you see the advances in the past, and still an important tool to advances nowadays, are big randomized studies, where average patients are treated with regimen A versus something added to it. But now, that was fine, but now when you see, we think a certain subgroup of lung cancer has a 2% of all, it's not so easy to study the groups. You need a catchment area to identify the patients. You need sites which have molecular capacity. So it's a very different story. And we think we may be able to have advances just on a study on 50 patients if they're identified right. So that needs a whole new infrastructure on how to deal with clinical research. And ETOP, and particularly our project, which is called Lungscape, is one answer to this need.
So Lungscape is looking at biomarkers, molecular markers.
Yeah, Lungscape will provide a platform for the top centers in Europe. It will be a virtual data bank of clinical data, TNM staging, digitalized pathology, and molecular data. In the first step, on a set of at least 1,500 operated patients up to 3 years ago, so with of clinical follow-up. And we will have eventually all those patients' tumors will be tested with the important molecular markers. So they will give a molecular landscape of what is happening in Europe in a way of the lung cancer topics.
So you've got something like a virtual biobank to give you this landscape. What kind of benefits will come from that?
Well, it's tremendous. I mean, the thing is, when a few of us, with this idea started, I think, it's very hard to say when did the idea start, but it started, let's say in May last year. We had a translational research meeting here in Lugano, supported by the San Salvatore Foundation, which is in Lugano, and we really said, this is the opportunity. Think about, there's a set of centers which have the capacity to do the molecular testing, and a new idea comes in from basic research. And the centers are there. Immediately you could see what is the frequency of a certain mutation. And we'll have a structure which will say, okay, we can identify it rapidly, even low frequency mutations, and we will have a structure to do the clinical studies on those patients. Plus, I mean, for example, TNM staging. So far, the data has been mostly on patients who were entering clinical trials. But to have a registry on patients, they don't have to be in a clinical trial. Just these are the patients that are operated in the different centers. We have all the data, and we have biological data. So we think we can add, like to the TNM, a biological part, TNMB, as I call it. So the opportunities are tremendous, and there's a lot of excitement within the community about it.
Indeed. Some of the presentations here in Lugano are predicting that there could be big differences in response rates and sizable improvements in survival and without any sacrificing of quality of life. How much do you think we can look forward to this level of optimism?
I'm usually very skeptical, but here I think this is what we're looking forward, the whole community.
So what should doctors be doing right now about all of this?
Well, first, doctors should keep abreast. They have to. It will take a while, but we all have to realize that what we called one disease, like lung cancer or non-small cell lung cancer, will break down in a multitude of diseases. That there will be an increasing need of competent centers that will help doctors in the molecular diagnosis. They will help in guidance and suggestion what might be the best treatment. So it needs a new type of networking to provide the best for your patient.
Now, you're the keynote lecture speaker, so what, in a few words, is the keynote of this meeting here in Lugano?
The keynote is working together in a respectful way, communicate and strive to the same goal. And this community is now formed, and this will provide the basis for the future.
Rolf, it's great to see you, and please carry on doing the good work, and we'll all be very interested to follow it.
Thank you.